come in, introduce myself. I'm your nurse. My name's April, and I'm going to be doing your postpartum assessment today. I provide for privacy. I do hand hygiene, and I don gloves. Um, I identify the patient by two identifiers. I ask her name and her birth date, and I check it with her bracelet. I raise the bed to a good working height, and the first thing I do, you try to keep the patient covered up. The first thing I do is I'll check her breasts, and she's a breastfeeder. So I'll make sure that they're soft and filling. I'll check her nipples and her areola and make sure they're dry. They're not dry or cracked. And I need to tell her that since she is a breastfeeder, that she needs to wear a good supportive bra. But if she would have been a bottle feeder, she would have needed to wear a tight bra, like a sports bra. Next thing I do is I'll go on down and I'll assess her abdomen, and I make sure that there's bowel sounds in all four quadrants, which they are, and they're active. I noticed if she's had a cesarean, I will assess the incision, make sure there's no redness or drainage, and that the edges are approximated. Okay, I'll ask her when her last bowel movement was, and if it was normal consistency and normal color. Okay, I'll try to palpitate the bladder. I shouldn't be able to palpitate it. I asked her when her last void was. It was about 30 minutes ago. And I asked her, was there any, was it painful? Was there any burning or urgency? Which there wasn't, which is good. And now I'll feel of her where her fundus is located. I'll hold her uterus. Then I'll feel her fundus. And since she's 2 days postpartum, it should be 2 finger breaths from the umbilicus, which it is. And then I'll palpitate her abdominal. All right. The next thing that I'll do is that I'll go check her loca, which there should be a pad here. And the pad should have, it's normal to have a moderate amount of loca, which is a dark reddish color, which is ruba. Okay. I need to tell her that the ruba go from to a serious color, which is a pinkish color. And then it'll go to an alba, which is a whitish clear color. If some reason it happens to revert, like from alba to ruba, or from serous to ruba, you need to contact your primary care provider. Okay, since that I was down here, I need to doff my gloves, do hand hygiene, and put new gloves on. Now, what I'll do is I'll check her lower extremities. Make sure there's no warmth, no redness, no edema, which they're not. I will check her popliteal pulses. I'll check her posterior tibula pulses and her pedal pulses. And to make sure they're equal and strong bilaterally, which they are. Now I'll tell her that I'm going to turn her over on her side. Okay, what I do when I turn her over on her side is if she's had an epidural or if she's had a spinal, I'll check that spot to make sure there's no drainage. If she's had an episiotomy, I will check that and make sure there's no redness or no drainage, no swelling. And I'll make sure that the edges are approximated. If she's got hemorrhoids, I will note the size of them and I'll note how many they are. Okay, I'll turn her back over. I will doff my gloves and do hand hygiene. Now I'm going to do some education. The first thing we'll educate her on is a car seat. And I'll ask her if she's got a new car seat or if she bought it off somebody, if it's used. Because you need to check the expiration date and make sure it's not been in a crash, because the material of it will deteriorate. All right. And then I need to educate her on SIDS, like putting the baby back to bed. When you put the baby in the bed, make sure you put them on their back. Make sure there's no covers, no pillows, no stuffed animals in there. This just reduces the risk of SIDS. Okay. Then I need to educate her on shaken baby syndrome. If you're frustrated, if the baby's crying and it won't quit, call a loved one, call a friend, see if they can come watch it, or even just put it back in put it in its crib or bassinet, because no baby's ever died from crying, but they have from being shaken. So that will reduce shaken baby syndrome. And I need to educate her on some things that she needs to do, some symptoms about calling the primary care provider. For you, it would be if you've had a temperature of 100.4 or greater, if you've had any localized redness or swelling or warmth in your breast, if you had any abdominal tenderness, any tenderness or painful in your perineum area, you need, or if your local reverts back, colors, you need to call your primary care provider. For your baby, if the baby's had a temperature of 100.4 or greater, if it refuses 2 consecutive bottle feedings, or if it's had 3 or more green watery stools, you need to call the primary care provider. Now what I'm going to do is I'm going to go get your baby, and I'm going to show you how to do with the bub syringe. Okay, I've done hand hygiene, I've put my gloves on. So what you need to do is you take the bub syringe and you compress it fully. You go in one cheek, squeeze, then you get rid of that secretions. Go in another cheek, get rid of that secretions. Go up one nostril, not too far, get rid of that secretions. Go up another nostrils, get rid of that secretions. And that's how you work the bub syringe. Now, do you want me to take the baby back to the nursery, or do you want to keep it with you? You want to keep it with you? Do you have any questions? No. So I let the bed back down to the lowest level. I put the Kyle right in reach, and I go document my findings.